We have mapped the 10 hotspots that are along the northern transport corridor, where we have stopovers for the truck drivers. We know these cases are occurring in the neighboring countries. And as the population they move, at times they get exposed and they move with the disease. So it is not basically the truck drivers alone, but even people that visit those countries that are reporting cases. So we have we have plans to sensitize the truck drivers so that they also report to us when they get sick. They report to us immediately. Like our first case of Mpox was actually a truck driver who called us. That driver called us through the Public Health Emergency Operations Center that he was suspecting that he had COVID and he was unable to proceed with the journey. So we had to pick him from Kikope area and brought him to isolation center. So we are sensitizing them through the associations and through the stakeholders that we are working with to ensure that they are able to report immediately. We're also sensitizing the patrons to the lodgings along the highway, because one of the modes of transmission is through linen. So we have sensitized the patrons, and we are continuing to sensitize them so that the handlers of this linen take the necessary precautions to ensure that they don't infect themselves. At the same time, they ensure that they disinfect the linen every time they are doing the cleaning and change them so that we don't have people using the same linen, because it's a risk for transmission.